Hi, I'm Dr. Robert Hedaya. I am the founder of the Center for Whole Psychiatry and Brain Recovery, located now in Eatontown, New Jersey. I'm also a clinical professor of psychiatry at Georgetown University and on the faculty of the Institute for Functional Medicine. Today, I'd like to share with you something that's fascinating. I'm going to show you how precise we can be in terms of identifying the nature and location and function of areas of the brain that affect a person clinically. In particular, today we're going to talk about a 29-year-old male, I'll call him Mark, who has recurrent history of bipolar psychotic episodes. And he has other conditions as well. He's showing some cognitive decline. He's got some temporal lobe dysregulation, meaning the temporal lobes that control mood and emotion are dysregulated, and various other problems. It's not a simple case, but none of our situations are simple. In this case, I want to show you how we're able to zero in not only on where the source, a major source of his problem is coming from in his brain itself, also how we can develop a plan to target that specific brain area. I think you're going to find this fascinating, and we'll try and keep this under 10 minutes, okay? I'm going to share my screen here, and what I'm going to show you here, for starters, here is quantitative EEG, and I'll explain this to you. In this, we take a cap, we put it on the head, and we measure the electricity that's coming from the head, and through a very specific formula called the inverse solution, you're able to determine what's going on inside the brain in a functional way, not the structure, but the function of certain areas, many areas actually of the brain. And then we take this and we correlate it to a MRI that is a neuroquant MRI that tells us about the structure of the areas of the brain. So we're comparing the function with this quantitative EEG and the structure with a neuroquant MRI. And that's what we're doing in this patient who's 29 years old with a bipolar disorder that has not been well controlled. I've seen him about 3 times now, and this is what we've got. So in this case, I'll just kind of show you around a little bit so you know what's going on. Anything that's gray, you see my cursor here, anything that's gray is normal. Anything that is yellow is too fast, which is no good, and anything that is blue is too slow, which is also no good. Now you notice there are a lot of gray areas here. We're only looking at a specific frequency right now, alpha, where he's having a fair number of problems, which is the relaxation stage of the brain where you kind of balance between inner and outer, not too upset, you're not too emotional, you're not thinking too much. It's kind of a relaxed state. And you can see in this case, in his relaxed state, there's a lot of overactivity in the brain in these particular areas here. Now, what is astounding really here is this is Mark's neuroquant MRI, and you can see here that it's listing all of these different areas, all of these different structures in the brain, from deep nuclei to the cingulate, which is anxiety, to the temporal lobes, which involves these various areas, sub-areas in the parietal lobe and the frontal lobe. Anything that is red is too small, anything that is blue is too big. And what I want to draw your attention to here is this supramarginal gyrus. You see that here, the supramarginal gyrus right here is in about the 1st percentile, okay? Now that means it's tiny compared with most people on the left, 5th percentile on the right, but very small. There's a lot of shrinkage there. Why is this important? This is important because the supramarginal gyrus is very much tied to bipolar disorder. So now we know that this guy, Mark, has a real deficit in his supramarginal gyrus, which is an area on the side towards the back of the brain. It's really not very large, and it's on both sides of his brain. And this supramarginal gyrus is involved in emotional regulation. It's involved in empathy, the ability to understand how other people feel. We call it mirror neurons are residing there, so you can imagine yourself into other people's shoes and what they're feeling. And it's involved with emotional egocentricity, your focus on yourself, and the ability to regulate emotions. So it's got these functions that you know in a patient with bipolar disorder are disrupted. And this has been confirmed in various large-scale studies showing that there's impairment in the supramarginal gyrus in schizophrenia as well as bipolar disorder. So this is very essential. And what we find here, okay, he's got a problem here. Well, that's very interesting. What can we do about it? So now we'll shift over here to his QEEG right here. And I'm going to show you a little bit of a different view that'll help us isolate the supramarginal gyrus. Now, every area on the surface of the brain has a number. It's called a Brodmann area. The supramarginal gyrus is area 39 and 40, mainly 40, but 39 and 40 pretty close together, and both involved in these functions. So what we're going to do is kind of isolate these here, different view of the same data. This is the right side of the brain. This is the left side of the brain. And these red dots are the areas in the brain, each with its own number to help us identify location. And we can see how well they're connecting to other parts of the brain. Now, this should all be black. There should be no abnormalities here. So all of these lines indicate problems with connection. So I'm looking for particular networks in the brain. They're like groups of highways that have specific functions. I'm looking for networks in the brain that might be involved with area 40 and area 39. And what we see here is, for example, in the addiction network, area 30 and 49 are not involved at all. In the anxiety network, not much and no involvement at all. In the attention network, area 40 is involved. And you can see here, he does have an abnormality. He's actually having trouble connecting with probably 7 different areas from the right side, but the left side's not having any trouble. Now, if we go to another attention network, we see that he's really not having any problem there. So we know the dorsal attention network, which is basically attention that you're conscious of, he's having some trouble here. So he's having trouble focusing and concentrating in this particular connection here. Now, if we go here, let's go here to, say, autism. There's a lot of areas involved. And we'll see here that I don't really see area 39 or 40. Well, let's go here to the default mode network, and we do see area 40 again having problems. Default mode network is your worry network. You see area 39 here is fine in this network. Area 40 is not fine at all. We go to planning, organization, which is the executive network. We see he's having some trouble here in area 40. And here, let's go here to language. Everything's pretty good on the right. On the left, there's a little problem with language, and he does show some problems with language. We'll go here to the mirror neurons. Here's area 40. You can see area 40 here. He's having problems on both, really on the right side. Left side is, one connection area that's not good. So he's having these problems because his supramarginal gyrus, area 40 and 39, are actually shrunken, really. So the connection is poor. So we can basically go through many, many other networks to determine where we see a problem. And then what we can do is actually target that network with neurofeedback or even laser treatment to the brain. It's across the skull, it's not invasive. And we can actually target these areas very specifically to actually bring their function into the normal. This case, it's actually over functioning because it's unstable. The area doesn't have enough energy to stay stable. We can actually target this and normalize it. And over time, we've been able to actually increase the size of these areas of the brain in 2 people that we've had pre-post measures. We don't usually get the pre-post measures, but in 2 people where we did, we actually saw that the size of specific areas in those patients actually increased from the 2nd percentile to the 48th percentile, which is completely in the mid-range of normal. The brain is plastic. I would not say I can guarantee that that will happen with this man. However, we can definitely help normalize the function through a combination of treatments. In this particular case, some neurofeedback and probably some laser treatment, which would help stimulate growth factors, increase blood flow, etc. So that's what I've got for you. I hope you find it useful. It's maybe a little complicated. I tried to keep it simple, but essentially, to dumb it down to the least, is basically we see in this bipolar male that the area called the supramarginal gyrus is very small compared to normal. It is associated with bipolar disorder, and we can use specific stimulation techniques to target that area in the brain, and these don't require much of anything on effort on his part. It's laser and neurofeedback. So that's what we got. Hope you have a great day. Feel free to please share this with your friends or loved ones, anyone you think might find it of interest. And of course, check out all we have on our website, www.wholepsychiatry, like Whole Foods with the W, wholepsychiatry.com. Have a great day. Thank you.